A warm welcome to all our viewers. We are here from Narayana Health City, Bangalore. I'm Dr. Samuela, Junior Consultant from the Department of Emergency Medicine, and I'm privileged to have here with me Dr. S Srinath Kumar, who is a Senior Consultant from the Department of Emergency Medicine and Group Coordinator of Narayana Hrudayalaya Limited. Welcome, sir.
Thank you, Dr. Samuela.
We have been surrounded by COVID-19 viral infection for almost 1.5 years now. And just when we thought we are winning the battle against this pandemic, there emerged post-COVID-19 syndrome. So today we are having a session on post-COVID-19 syndrome. So my first question to you would be, what are the signs and symptoms that we are looking for when we say it is a post-COVID-19 syndrome?
As per the literature, what I have gone through and the WHO guidelines also, there is no as such the terminology saying as post-COVID-19 syndrome. But a lot of people post-COVID, they come back to hospital saying that they have developed post-COVID syndrome. And most of the common symptoms is fatigueness. That's what is the most common which we have seen. Apart from it, there can be like they come with a breathlessness or headache, or they have some chest pain, or they have severe cough, or they are unable to walk. So these are the common symptoms which they come back to the hospital and represent to us.
All right, sir. Since you mentioned fatigue is the most common symptom,
Yeah.
What is this terminology called as chronic fatigue syndrome? Can you talk about that?
Yeah, it's a very good question. So because you and we are seeing more of fatigue syndromes commonly, it is a multiple things which is involved. So that is the reason why they developed something called as a brain fog. And then with the post-COVID nature within the body is developing them to have some kind of a illness which is developed, and they come back and say that we are developed fatigueness. That's
Okay.
what it is.
Okay, all right, sir. So there have been a lot of talks in the society these days about the ability of COVID causing clotting problems. So
Yeah.
what is your say on that, sir?
So what do you mean by clotting? It's nothing but there is some kind of a blood which is getting clotted in some part of the body. The most common symptom why this clot is happening is because it is just because of the clumping of the blood vessels. When there is a clumping of the blood vessels, it is commonly seen with the COVID-19. And this clots can sit anywhere in the body. It can sit in the intestine. Then the patient will have pain abdomen. He'll come back and say that he has developed pain abdomen. If it sits in the clot sits in the heart, we all know that is myocardial infarction or heart attack. And if it starts sitting in the carotid arteries or in the brain, it is there and they develop it as a stroke. And we all know. So these are the various types of the clots wherein they sit and they develop the syndromes, and we see it as a common things in the emergency department. So this is the problem with the COVID-19 clotting disorders.
So when we say this, who do you think is more at risk for this, post-COVID symptoms?
So another good question, because this is the common question which the people ask us. So you are mentioning that where do we see the common people who come with a post-COVID syndrome? So we have seen, as per the literature, as per the studies which we have come across all over the world, it is mainly seen in the elder population, females, and those who are obese or already having 3 or more comorbidities, like a patient having a COPD, that is chronic obstructive pulmonary disease, or an asthmatic. These are lung involvements. Or the patients can have a hypertension or a diabetes mellitus. So these are the people whom commonly the post-COVID syndrome occurs. To add upon this, we have 3 types of variants which come to the hospitals. One is asymptomatic positive, that is mild, moderate, or severe COVID-19. So this is very commonly seen with severe COVID-19 people. And not only this, specifically if you see the second wave, the younger population is also involved, and those who had a severe COVID, they come back with a post-COVID syndrome. That's what is commonly seen. I hope this answers your question.
Yes, sir, definitely. I think a lot of viewers have this question on their mind that if they can spread the infection, that is COVID-19, when they have this post-COVID symptoms, what do you want to say about that?
Again, a good question. So, you were telling about the post-COVID, when they can be able to spread the disease to others. Yes. See, the COVID-19 is such a way that only in the first 10 days it has been seen to be contagious and it spreads across. Beyond that, there is no scientific research which has shown that it spreads. So, post-COVID illness is not per se of the COVID-19 illness. It is mainly because of other factors which has been involved, and thereby the post-COVID-19 syndrome occurs. So, we can be rest assured that these people don't spread the COVID illness to others, those who come with post-COVID illness.
Okay, all right, sir. So, how long do you think the post-COVID symptoms or the syndrome last for? And how long do they need this post-COVID care after the infection?
Okay. Since we all know that this disease is very new to the world and many medical researches are still happening, we are not sure that this is the timeline or this is the time cutoff that, okay, this is within 1 week or 1 month, it ends. Nothing like that. It has ranged from weeks, months, and some of them we have seen more than 6 months or 7 months also. So the post-COVID-19 syndrome depends upon the organ which is involved and where it is involved and what are the symptoms and signs. They come back to the hospital and they are staying back in the house. So this is the range of the illness which post-COVID-19 syndrome is present.
Okay, all right, sir. So, what are the treatment options that we're looking for when the patient is developing this post-COVID symptoms?
So again, it depends upon which organ is involved. Most commonly we have seen with the respiratory illness. So that is the lung involvement which we see on the CT scan. So these patients in the post-COVID-19 syndrome, they come back with the lung involvement most of the time. So they need more of a breathing exercises, walking and these things. If you take another illness, that is let it be stroke or myocardial infarction, they have to go to that specific department. Like stroke means they have to visit a neurologist. If they have a cardiac ailment, that is myocardial infarction or any other cardiac involvement, they have to visit the cardiologist and take the treatment accordingly. I hope this answers your question.
Yes, sir. Many people have this taboo over this side effects of the treatment that is given during the during the COVID-19 infection, especially steroids causing mucor, or more commonly called as black fungus. So, what do you want to say about that?
I would like to take the taboo out of the general public. See, this is a treatment protocol which we have to follow. If you take another illness like asthma or any other immunocompromised illnesses, there we certainly use steroids. In the same way, during the COVID illness, those who have moderate or severe illness, they will require a certain amount of the steroids. Only side effects of the steroids in these particular illnesses, those who already have an underlying diabetes or on the borderline diabetes who are about to start having diabetes mellitus. So in these patients, what happens is when you give steroids, the sugar levels will increase. That doesn't mean that it will cause mucormycosis or black fungus illness. So your only aim in the hospital or in the general public is we are treating the diabetes mellitus, which is a side effect of the steroid use, and we bring down the sugar levels to keep it as near normal as possible. And some patients have required high doses of insulin even after going back home. This is the only taboo which they have to keep in the mind. But steroids is not a per se which is going to cause black fungus illness or mucormycosis.
All right, sir. Thank you for busting that myth. Now, since the vaccination is going all around the country, there is a question, I think, is there in all of our minds that should I get vaccinated if I've got the disease, that is COVID-19 infection? So, what do you want to say about that?
See, COVID-19 will already produce certain amount of antibodies, but that usually lasts for 2 or 3 months. So to boost up the antibody levels, it doesn't mean that you get a COVID-19 illness this time. You're not sure that you're not going to get again. Yes, you may get again. There is study showing that those patients who had COVID-19 can get the second time also. So it is good to take the vaccine dose as per the schedule. Usually what we give is, if they are not vaccinated, we give them the first dose after 90 days. If they are already vaccinated with one dose, have the infection, then we give it after 60 days. This is as per the ICMR protocol.
Okay, a similar question on that. Can pregnant women take this vaccine?
Yeah, recent guidelines says the government of India and the ICMR guidelines have given instructions that they can be vaccinated during pregnancy also.
Okay, all right, sir. So my last question to you would be, what are your tips on mental health and well-being? Because this is causing a lot of anxiety on a lot of us. So what do you think we have to do about this?
It's a post-trauma. COVID-19 itself, when somebody gets a COVID-19, they always have their myth in their mind. Okay, what is going to happen to me? Am I going to die? Am I going to have this post-COVID illness? All these things will be there in their mind. That is called as post-traumatic stress syndrome. Or they go in for a lot of depression. They go in for anxiety. So these are the time when they have to have a counseling with the psychiatrist or the psychologist to have a counseling, and they are the better people who can understand them, have a counseling sessions, and that brings down the anxiety or the depression, and they come out of the illness of the psychological illness. Even adding to it, especially in the family also, they are also bound to have this traumatic stress syndromes. So as a whole, the whole family is better to have a psychiatric counseling or a continuous speech to them that will help them to alleviate their anxiety or their depression.
Okay, thank you so much, sir. Thank you for your wonderful insight. I'm sure our viewers would have found this very informative. Thank you and have a good day.
Thank you all. Thank you.